Epilepsy Basics. What is the blood-brain barrier? Have you ever wondered how the brain protects itself from harmful substances while still getting the nutrients it needs? This is where the blood-brain barrier comes into play. The blood-brain barrier is a highly selective protective layer of cells that surrounds the blood vessels in the brain. Think of it as a gatekeeper that controls what can enter the brain from the bloodstream. Its main job is to shield the brain from toxins, pathogens, and certain chemicals that could be harmful, while allowing essential nutrients to pass through. Structurally, the blood-brain barrier is made up of tightly joined cells called endothelial cells that line the brain's capillaries. These cells are supported by other cells like astrocytes and parasites. The tight junctions between these endothelial cells are what keep most substances from slipping through. This is different from blood vessels in other parts of the body, where small gaps exist. By maintaining this tight control, the blood-brain barrier helps keep the brain's environment stable, which is crucial for normal brain function. The blood-brain barrier selectively allows small, lipid-soluble molecules like oxygen and carbon dioxide to pass through easily. It also actively transports vital nutrients such as glucose and amino acids using specialized transport proteins. However, it restricts larger molecules and many drugs from entering the brain. This can make it challenging to deliver medications for brain disorders, including epilepsy. In the context of epilepsy and seizures, the integrity of the blood-brain barrier is particularly important. If the barrier is disrupted or damaged, harmful substances or immune cells can enter the brain tissue. This can lead to inflammation or abnormal electrical activity, which may trigger seizures or worsen epilepsy. Some studies suggest that dysfunction of the blood-brain barrier may play a role in certain types of epilepsy, but this is still being researched. Keeping the blood-brain barrier functioning well is essential for protecting the brain's delicate chemical balance. It helps prevent infections and toxins from causing damage. However, because the blood-brain barrier also limits drug access, developing effective treatments for epilepsy often requires innovative strategies to safely bypass this barrier. In summary, the blood-brain barrier is a crucial protective system that regulates what substances can enter the brain from the bloodstream. It plays a vital role in maintaining brain health and stability, which is essential for understanding and managing epilepsy and seizures. If you have questions about how this relates to your health, it is always best to consult a healthcare professional for personalized advice.